We're going to review how to systematically approach a slide review prior to doing a white cell differential, a red cell morphology, and a platelet estimate. You want to start on 10 power and you want to cruise right to the very end of the smear so you cannot see anything else. That way you will be sure that you will find any platelet clumps, which is represented here, any parasites such as heartworm. They hang out in the tails and often on the sides of the smear. Sometimes you will see mast cells out here, and sometimes other atypical cells, but they can be harder to spot. But the main things are platelet clumps and parasites. When you go to do your actual white cell differential count, again, you don't want to be out here. So we were out there before to look for smear quality and platelet clumps, but we don't want to be doing our differentials out here, because wherever you see blank spaces, A, it's going to take you forever to do differential, and B, your cells look very distorted out here. So you want to move to an area, it's usually about a field and a half in from the end of the feather edge, to find the spot where your cells are not overlapping and they're not too widely spread. So this area is known as the monolayer, and this is where you want to live when you're doing your slide evaluation. Conversely, you don't want to go near where the blood drop has been applied, because this is where the red cells are way too stuck on top of each other for you to recognize any part of a red cell morphology or a white cell differential for that matter, because the white cells get all crunched. So again, we're on 10 power. We're going to move over to the monolayer, and we'll go down to the 40 dry power. And this is just for you to get a feel again of where the monolayer is and a big picture of the white blood cells that you're looking at. So for example, you want to know that these are typical neutrophils and that you're not going to confuse them later with monocytes, which would be that cell there. So you just want to get comfortable with your cell identification. So there we have a lymphocyte, 3 neutrophils, and an eosinophil. And this cell is somewhat disintegrated, so we wouldn't count it. If in the course of your evaluation you find disintegrated cells, only call ones that have an intact cytoplasm. And every slide will have some disintegrated cells. So once you feel comfortable that you're in the right area and you have a pretty good idea as to what's going on with your cells, you'll go down to 100 oil, which is where you'll do your white cell differential, your red cell morphology, and your platelet estimate. One other thing that you can do on the 10 power objective is a white cell estimate. And it just gives you a rough idea as to if you are dealing with a normal white cell count, elevated or decreased. Again, note the word rough. So don't get too concerned if the estimates that you do don't completely line up with the numbers that we provide you. It very much depends on the animal's PCV, how good the slide maker was, and if the animal is anemic or not. So what you do is you count your white cells on 10 power. So you will count along to however many you get, average 3 to 5 fields, and then divide that number by 4. And that gives you a white cell estimate times 10 to the 9th per liter. If you have nucleated red cells, you may or may not be able to count them from this or differentiate them on this power, but you want to count them inside your estimate because there is a formula for correcting for that. If your white count is really high and you think, oh my goodness, I am never going to be able to do that, just count a quarter of the field and multiply it by 4, and then do that 3 to 5 times and divide it by 4 to give you your estimate. Or if you can count half the field, multiply by 2 accordingly. We will go down to the 100 oil objective, and this is where we will do our white cell differential and our red cell morphology and platelet estimate. To do the white cell differential, again, you want to be in the monolayer of your blood smear, and you will start one end and work your way up and then go one field over. So I'll just go to the end of a smear here. So we're moving across the slide until we encounter a white cell, in which case we will enumerate it. So that would be a lymphocyte and a neutrophil and another neutrophil, and so on. And you just keep going until you reach the other end of the slide. When it gets thin again, then what you'll do is you will move your field one field over towards the thicker end of the slide and carry on and just go down. And you do that until you reach 100 white blood cells. If you encounter nucleated red blood cells, they are counted on top of your white blood cells. So you always count 100 white blood cells, and then your nucleated reds are on the side. So that number comes out as X nucleated reds per 100 white cells. The next step would be to do your red cell morphology. Again, you want to be in the monolayer area where you have things nicely spread, not overlapped, and not too thin. If we end up in the thin area, you can see that you see very little detail on your red cells. They all look like spherocytes, and you've got big gaps in between your red cells. And conversely, if you're in too thick an area, the cells are all on top of one another, and you can't adequately differentiate the red cell types. Here the white cells are not too bad, but as you get deeper, they get tougher to tell. So again, we're zooming back out to the monolayer area. So this is where you do your red cell morphology, looking for size and shape changes and color changes if you have hypochromia or polychromasia. And the other thing that you do on this power is review your platelets. So we saw at the beginning of this presentation that there were large platelet clumps in the feather edge of the smear. That is going to immensely throw off your platelet estimate. There is a couple of platelets in this field, here and here, but they are not overly plentiful. For a normal canine, which this is, you want to have about 10 platelets per high power field. If you're doing an estimate, each platelet is worth approximately 20 times 10 to the 9th per liter. To do an estimate, average 3 to 5 fields, multiply that number by 20. In this case, you could say, oh my goodness, this dog does not have very many platelets. They are rather few and far between. But going back to 10 power, if you've checked out in your feather edge, then you'll see, oh, they're probably okay because there's lots of big clumps out here. So that's probably the largest reason to check your feather edges for platelet clumps.